Understanding and responding to triggers in relapse prevention. Hello, my name is Jared Boss. I'm currently in college pursuing my degree to become a substance use disorder professional, or SUDP. My goal is to help individuals in recovery find their way back to stability, purpose, and a life they feel proud of. I have personal connection to this work as I have been through recovery myself, and I know firsthand how challenging and complicated the journey can be. Experiencing addiction in the process of recovery has given me a unique perspective that goes beyond textbooks and theory. I understand the emotional, mental, and physical challenges clients face, as well as the fears and obstacles that can make relapse feel almost inevitable at times. Because of my own journey, I have developed a sense of empathy for people who are struggling, and I feel a responsibility to support those who are committed to making changes in their lives. I know what it feels like to want help but not know where to turn, to feel the weight of triggers, and to struggle with maintaining progress. That personal experience fuels my passion for this work. It drives me to not only provide clinical knowledge and evidence-based strategies, but also to connect with clients in a way that is understanding, non-judgmental, and encouraging. My hope today is to share insights and practical tools that you, as practitioners, can use to help clients recognize and respond to triggers before they escalate, because I know from experience that the right support and the right time can make all the difference in someone's recovery journey. Many clinicians are familiar with the concept of triggers and can often identify them in their clients. We can recognize the signs of stress, cravings, or environmental cues that might put someone at risk for relapse. However, simply identifying triggers is not enough. Too often we lack structured, consistent strategies to help clients respond effectively when those triggers arise. Without concrete tools and interventions, triggers can quickly lead to lapses or relapses, despite a client's motivation and best intentions. Today we are going to go beyond just the theory of relapse triggers. We'll focus on practical, evidence-based interventions that you can implement directly into your clinical practice. I want to give you the tools to not only help your clients understand what triggers them, but also equip them with actionable strategies to manage those triggers before they escalate into a relapse. By the end of the session, you'll have a deeper understanding of both internal and external triggers, insight into how triggers influence behavior, and a clear set of strategies from functional analysis to skills rehearsal and lapse response planning that can be immediately applied with your clients. This is about giving you actionable skills, not just knowledge, so you can make a tangible difference in the recovery journey of the people you serve. By the end of this training, participants will develop a clear understanding of how relapse triggers work and how clinicians can respond to them effectively. First, participants will be able to identify both internal and external relapse triggers. Internal triggers include emotional and physical experiences such as stress, fatigue, shame, intrusive thoughts, or strong emotions. External triggers are environmental factors such as specific people, places, events, or sensory cues like smells, music, or visual reminders associated with past substance use. Participants will also learn how triggers can present themselves in different ways. Some triggers are very obvious and predictable, while others can be subtle or unexpected. Because of this, clinicians might use thoughtful assessment techniques to help uncover triggers that clients may not openly recognize or report. Another goal of this training is to understand how triggers influence client behavior. This includes exploring the neurobiological and psychological mechanisms behind triggers, such as conditioned responses and automatic cravings that develop through repeated substance use. Participants will also examine how triggers interact with a client's thoughts, emotions, and coping skills. These interactions can influence decision making and increase the risk of relapse if coping strategies are not effectively used. It is also important to recognize that relapse is rarely a single event. Instead, relapse often occurs as a gradual process that builds over time. Understanding this process allows clinicians to intervene early and prevent escalation. Finally, participants will learn how to apply several evidence-based response strategies when triggers occur. These strategies include using functional analysis or chain analysis to break down high-risk situations and identify opportunities for intervention. Clinicians will also learn how to teach and rehearse coping skills with clients, such as urge surfing, grounding techniques, and assertive refusal skills. Practicing these skills in session helps clients feel more confident using them in real-world situations. Additional strategies include environmental restructuring, which helps reduce exposure to high-risk triggers while strengthening protective routines and healthier behaviors. Participants will also learn how to develop relapse response plans that prepare clients for potential setbacks. These plans help clients respond quickly and effectively if a lapse occurs, reducing shame and preventing the lapse from developing into a full relapse. Overall, the goal of this training is to provide clinicians with practical tools and strategies that can be applied directly to their work to help clients manage triggers and maintain recovery. First, we will start with what is a trigger. A trigger is any internal or external stimulus that provokes craving, emotional dysregulation, or conditioned substance use behavior. There's two types, external and internal. First, we are going to talk about external triggers. They are things outside of the client that can remind them of past substance use or create pressure to use again. These triggers come from the person's environment and can activate cravings or memories associated with substance use. Examples of external triggers include specific people or social networks, especially former using peers who may still be engaging in substance use. Being around these individuals can increase temptation or social pressure. Locations can also act as powerful triggers. This might include places like bars, certain neighborhoods, or even specific rooms in a client's home where they previously used substances. Events can also trigger cravings. Holidays, birthdays, paydays, and celebrations are common examples because substance use may have been associated with those events in the past. Finally, sensory cues can trigger cravings as well. Things like certain smells, music, or visual reminders of substances can activate memories and emotional responses connected to past substance use. The key point is that these environmental cues can trigger automatic responses in the brain, which is why it's important for clinicians to help clients identify and plan for these situations. Internal triggers are experiences that occur within the client, and they are often even more powerful than external triggers. These include emotional, cognitive, and physical states that increase the risk of cravings or relapse. Common emotional triggers include stress, anxiety, sadness, loneliness, shame, or anxiety. When clients experience intense emotions, they may remember that substances previously helped them cope with those feelings. There are also cognitive triggers, such as intrusive thoughts, cravings, or rumination. A client might begin thinking things like just one won't hurt, or I deserve a break, which can increase the risk of substance use. Physical states can also trigger cravings. Things like fatigue, hunger, illness, or physical pain can lower a person's ability to cope with stress and increase vulnerability to relapse. One useful framework for understanding internal triggers is the HALT model, which stands for hungry, angry, lonely, and tired. When clients are experiencing these states, their risk for relapse tends to increase. Internal triggers are often subtle and sometimes go unnoticed, which is why clinicians should intentionally assess emotions and physical states during treatment. Triggers are not just psychological experiences. They are also deeply connected to brain function and neurobiology. One important system involved is the brain's dopamine reward pathway. Substance use releases dopamine, which reinforces behaviors that the brain perceives as rewarding. Over time, the brain begins to associate certain cues or situations with that reward. The amygdala plays a role in emotional memory. It stores emotional experiences connected to substance use, which means that certain triggers can automatically activate strong emotional responses. The hippocampus is responsible for contextual memory. This part of the brain helps store memories related to environments or situations where substance use occurred. As a result, returning to similar environments can trigger cravings. The prefrontal cortex is responsible for decision making and impulse control. However, chronic substance use can weaken this area of the brain, making it more difficult for individuals to resist urges or make healthy decisions when triggers appear. Stress also plays a major role. When stress levels increase, cortisol levels rise, which can intensify cravings and increase relapse risk. Because of these neurobiological processes, triggers often create automatic responses in the brain. This is why simply telling someone to just resist is usually not effective. Instead, clients need structured coping strategies to manage these responses. Relapse is rarely a single event. Instead, it is usually a process that develops over time when triggers are not recognized or effectively managed. One of the most well-known frameworks for understanding this process is Marlat's relapse prevention model. This model helps clinicians see how relapse can develop step by step rather than happening suddenly. The first stage is a high-risk situation, where the client encounters a trigger. This trigger might be internal, such as stress, sadness, or fatigue, or external, such as being around former using peers or returning to environments associated with past substance use. The next stage occurs when the client has an ineffective coping response. This means they either do not have the coping skills needed to manage the situation, or they fail to use the skills they already know. When this happens, cravings begin to intensify, and the client may start experiencing cognitive disorientations. These are thoughts such as, just one time won't matter, or I can't handle this without using. At this point, a lapse may occur, which is a brief return to substance use. After a lapse, many clients experience what Marlat called the abstinence violation effect. This involves feeling of shame, guilt, or thoughts of, I failed completely. These negative thoughts can increase the likelihood that the person continues using and moves into a full-blown relapse. The key clinical takeaway is that relapse can often be prevented through early recognition and intervention. If we identify triggers early and help clients use coping strategies, we can interrupt the process before it escalates. For example, a client experiencing stress at work may skip using a coping strategy and have a small lapse. If we address that lapse quickly, normalize the experience, and help the client follow a lapse response plan, they are much less likely to spiral into a full relapse. Now that we understand what triggers are, how they affect the brain, and how relapse develops as a process, we can move on to identifying common triggers in clinical practice and the strategies we can use to respond to them effectively. External triggers are environmental factors that can remind a client of past substance use or increase pressure to use again. One of the most common external triggers involves social networks. Former using peers or friends who continue to use substances can create powerful social pressures or reminders of past behaviors. Physical environments can also trigger cravings. This might include bars, certain neighborhoods, or even specific rooms in a client's home where substance use previously occurred. Certain events can also act as triggers. Holidays, birthdays, paydays, and celebrations are common situations where substances may have been used in the past, making them high-risk situations for clients in recovery. Finally, sensory cues can also trigger cravings, smells, music, or visual reminders associated with past substance use can activate emotional memories and cravings. Clinically, it is important to remember that while avoiding triggers can help stabilize recovery, avoidance alone is not enough. Clients still need coping skills to manage triggers while they inevitably occur. Internal triggers occur within the client and are often even more powerful predictors of relapse than external triggers. These triggers typically involve emotional states such as stress, anger, shame, loneliness, or anxiety. When these emotions become intense, clients may remember that substances once helped them cope with those feelings. Physical states can also increase relapse risk. Fatigue, hunger, illness, or physical pain can reduce a person's ability to cope with stress and increase vulnerability to cravings. One useful framework clinicians often use is the HALT model. HALT stands for hungry, angry, lonely, and tired. When clients experience one or more of these states, their relapse risk tends to increase. A key clinician point is that internal triggers are often overlooked during assessments. Many clinicians focus primarily on external triggers, such as environments or people, but emotional and physical states are frequently stronger drivers of relapse. Because of this, it is important to intentionally explore internal triggers during treatment. Some client populations are at higher risk for relapse due to additional challenges that interact with substance use disorders. Clients with co-occurring mental health disorders, such as depression, anxiety, or PTSD, often experience more intense emotional triggers, which can increase the likelihood of relapse. Individuals with trauma histories may also experience strong emotional responses when triggered, making substance use feel like a way to manage distressing memories or feelings. Chronic pain is another significant risk factor. Clients who experience ongoing physical pain may feel tempted to use substances as a way to manage discomfort. Finally, individuals with limited social support often lack protective relationships that can help them maintain recovery during stressful periods. Because of these factors, integrated treatment approaches that address both substance use and underlying mental health or social needs tend to produce better outcomes. Functional analysis, also called chain analysis, is a method we use to break down high-risk situations into their key components. We examine the events that occurred before the risky behavior, the thoughts and beliefs the client experienced, their emotional state, the behaviors they engaged in, and the short-term and long-term consequences of those behaviors. Using functional analysis regularly, not just after a relapse, allows both the client and the clinician to identify patterns, anticipate high risk situations, and intervene proactively before a lapse occurs. It helps clients understand what triggers their cravings or urges and gives them the tools to manage these situations more effectively. By breaking down high risk moments step by step, clients can see where intervention strategies can be applied and learn to respond to triggers with healthier coping strategies rather than reactive behaviors. This makes relapse prevention more concrete and actionable. Teaching coping skills is not enough on its own. Clients need to practice skills such as urge surfing, grounding exercises, using the five senses, distress tolerance techniques, and assertive refusal skills until these responses become automatic. Practicing these skills during sessions builds confidence and self-efficacy. When clients encounter real-life triggers, they are more likely to respond effectively rather than relying on willpower alone. Role-playing and guiding practice in a controlled environment allows clients to rehearse these strategies safely, making them second nature over time. By combining functional analysis with skills rehearsal, clients not only understand their triggers, but also develop practical tools to manage high-risk situations successfully. Environmental restructuring focuses on changing a client's surroundings to reduce exposure to triggers. This can include removing high-risk contacts from their social network, adjusting daily routines to avoid high-risk situations, and increasing engagement in structured, pro-social activities. Creating a more supportive environment strengthens protective factors and makes relapse less likely. It's important to remember that this strategy works best in combination with coping skills rehearsal and planning. While changing the environment reduces external triggers, it does not address internal triggers such as stress, fatigue, or emotional distress. By combining environmental restructuring with practiced coping skills and functional analysis, clients are better prepared to handle both internal and external triggers, giving them a stronger foundation for long-term recovery. Building on environmental restructuring, we also need to prepare clients for the possibility of a slip. A lapse response plan gives clients a clear, actionable roadmap for how to respond if they experience a minor relapse. The plan should outline who to contact immediately, steps to take within the first 24 hours, strategies for managing cravings, and a way to normalize the lapse as a learning opportunity. By providing a structured plan, clients act quickly to prevent a minor lapse from escalating into a full relapse. Lapse response planning helps reduce shame and maintain self-efficacy. It reinforces the message that lapses are a normal part of recovery rather than a failure. When combined with coping skills, rehearsal, and environmental restructuring, this plan gives clients a complete set of tools to respond proactively to both internal and external triggers. Now that we've discussed several evidence-based strategies for responding to triggers, it's helpful to see how these concepts apply in a real-world clinical situation. Case examples allow us to think through how internal and external triggers interact and how clinicians may decide which interventions to prioritize. Let's look at a brief case scenario. Maria is a 34-year-old woman with alcohol use disorder who has been sober for 4 months. She is currently experiencing increased stress at work, and the anniversary of her mother's death is approaching, which makes this a particularly vulnerable time for her. In Maria's case, there are both internal and external triggers present. Internally, she is dealing with stress and grief, which can increase emotional vulnerability and cravings. Externally, She may face social pressures or reminders associated with the anniversary that could also trigger the urge to drink. As clinicians, situations like this require us to think carefully about which interventions to prioritize. We might consider strategies such as functional analysis, coping skills rehearsal, environmental restructuring, or developing a lapse response plan. This case helps illustrate how internal and external triggers can interact and why proactive relapse prevention strategies are so important in supporting clients through high-risk situations. Now that we've introduced Maria's situation, the next step is to identify the specific triggers that may increase her risk for relapse. First, let's look at the internal triggers. These are the emotional and physical experiences occurring within Maria. In her case, she is dealing with increased stress from her workload, which can already create emotional strain. At the same time, she is experiencing grief related to the anniversary of her mother's death, which can intensify emotional vulnerability. She may also be experiencing fatigue if stress and emotional distress are affecting her sleep or energy levels. Next, we can identify the external triggers in Maria's environment. These include anniversary-related events, such as family gatherings or rituals that may remind her of her loss. She may also experience social pressure from coworkers or friends, especially if alcohol is present during social events. In addition, certain locations associated with past drinking could act as environmental cues that trigger cravings. When we look at both types of triggers together, we can see how internal and external factors interact. For example, Maria's stress and grief may make her more emotionally vulnerable, which can make external cues like social events or familiar environments even more difficult to manage. Identifying these triggers is an important step because it helps clinicians determine where and how to intervene before a lapse occurs. Now that we have identified both the internal and external triggers in Maria's situation, the next step is to think about how we would intervene as clinicians. At this point, we want to consider which strategies might be the most helpful in reducing her risk for relapse. One option is functional analysis, where we break down the chain of events leading to high-risk moments. This helps Maria understand how her stress, thoughts, emotions, and behaviors interact, so she can recognize warning signs earlier. Another strategy would be coping skills rehearsal. Because Maria is dealing with stress and grief, practicing skills such as grounding techniques, urge surfing, or emotional regulation strategies could help her manage those internal triggers more effectively. We might also consider environmental restructuring. This could involve adjusting routines, temporarily avoiding certain high-risk events related to the anniversary, or increasing supportive and structured activities during this difficult time. Finally, we could develop a lapse prevention plan or a lapse response plan with Maria. This would give her clear steps to follow if she begins experiencing intense cravings or if a lapse occurs, including who to contact and what action to take within the first 24 hours. When prioritizing interventions, clinicians often start with the most immediate risk. In many cases, addressing internal triggers such as stress or grief first can give clients the tools they need to better manage external triggers in their environment. This process of identifying triggers and selecting targeted interventions is a key part of proactive relapse prevention. Now it's time to reflect on how the concepts we've discussed apply to your own clinical practice. First, are internal triggers assessed routinely? Many clinicians focus heavily on external triggers, such as situations, environments, or social pressures, but internal triggers like stress, anger, grief, or fatigue can be even stronger predictors of relapse. Ask yourself, do I actively assess my client's emotional states and physical cues? Do I ask open ended questions about how they feel during high risk situations? For example, during intake or before each session, do you include questions like, how are you feeling emotionally or physically before high risk situations? Second, are coping skills rehearsed in session? It is one thing to teach coping skills, but another to help clients practice them until they become automatic. Reflect on whether you provide opportunities for clients to role play refusal skills, practice grounding techniques, or simulate urge surfing during sessions. For example, if a client identifies stress as a trigger, do you practice mindfulness or relaxation strategies together during the session? Third, does every client have a written lapse response plan? A concrete plan is critical from preventing a minor slip from escalating into a full relapse. Consider whether you consistently help clients create a written plan that includes contacts, steps to take in the first 24 hours, and strategies to reduce shame and normalize lapses. Could a client pick up their plan from a folder or phone and follow it immediately after experiencing a craving? During this recorded session, pause and take notes on your current practices. Identify gaps and think about one change you could implement immediately in your clinical work. Reflection like this helps consolidate knowledge and translate it into practice. By intentionally assessing triggers, rehearsing coping skills, and providing structured lapse response plans, we equipped clients with the tools they need to manage high-risk situations and maintain their recovery. As we wrap up, there are a few key points to remember. First, triggers are not simply temptations or poor decisions. They are neurobiological and behavioral responses that develop through repeated substance use and learned associations in the brain. Because of this, clients often experience cravings automatically when they encounter certain cues. Another important takeaway is that internal triggers such as stress, fatigue, grief, or emotional distress often drive relapse more strongly than external triggers. While clients may be able to avoid certain environments, internal emotional states can still increase relapse risk if they are not addressed. Using structured assessment helps clinicians identify these risks early. By consistently exploring both internal and external triggers, we can better understand the situations that place our clients at risk. Practicing coping skills during sessions is also critical. When clients rehearse techniques such as grounding, urge surfing, or refusal skills in a supportive environment, they are more prepared to use those strategies in real-life situations. Finally, every client should have a written lapse response plan. This provides a clear roadmap for what to do if a lapse occurs and helps reduce shame while preventing a small setback from escalating into a full relapse. Together, these practices can strengthen recovery skills and significantly improve client outcomes. As we conclude, it's important to remember that relapse prevention is not about completely eliminating triggers. In reality, triggers are a normal part of life and cannot always be avoided. Instead, relapse prevention focuses on helping clients recognize their triggers, developing effective coping skills, and create structured response plans that guide them through high-risk situations. The goal is to prepare clients to respond effectively when triggers occur so they can maintain control over their recovery rather than feeling overwhelmed by cravings or stress. Recovery is possible, but it requires preparation, consistent support, and empathy from practitioners. By combining knowledge, practical skill building, and structured planning, we can provide clients with the tools they need to navigate challenges and sustain long term recovery. Ultimately, our role as clinicians is to support, guide, and empower clients as they build the skills and confidence necessary to maintain their recovery journey. This slide lists the sources I used to develop today's presentation. These include foundational texts on relapse prevention, evidence-based strategies, and guidelines from respected organizations in the behavioral health field. I encourage you to consult these sources for more in-depth information or to support your own clinical practice. They provide the research and evidence behind these strategies we've discussed, and they can be valuable resources as you continue to work with clients in recovery.